Welcome to Frontline News from the University of Maryland School of Medicine News Center. I'm Larry Roberts. Coming up, it's back to school during the pandemic. Plus, a new trauma-informed psychiatric unit for kids and teens. But first, have you ever met someone you instantly liked or instantly disliked without knowing why? A new study suggests that there may be a biological basis behind this instantaneous compatibility reaction.
It seems that there could be, at least in part, a genetic basis for friendship, really. That kind of instant feeling you get when you meet certain people. You just automatically gravitate towards certain people. You like them.
Dr. Mishi Kelly is investigating the phenomenon in a mouse model by removing the gene for a brain enzyme called PD11.
We found that when we knocked out that gene, it would change how much a mouse wanted to interact with another mouse that had both of their copies of PD11. But we had a student join the lab who had been working with some children with autism. And he had made an offhanded comment one day that he felt that the children who had autism actually preferred to interact with other children that had autism as opposed to normally developing children.
That observation inspired Dr. Kelly to change the parameters of the experiment.
So we took our knockout mouse and now asked it, would you prefer to interact with another mouse that doesn't have PD11 over a mouse that does have PD11? And sure enough, the knockout mice preferred to interact with the other knockout mice, whereas what we call wild type mice, these are mice with two normal copies of the gene, they prefer to interact with the mice that have the two normal copies of the gene.
Researchers haven't figured out how the knockout mice can identify each other, but they have a theory.
Our working hypothesis is that it may have to do with how they communicate with each other. So just like humans talk to each other, mice also talk to each other. Although we can't hear it, it's called ultrasonic vocalizations. For the average person, when you think of a dog whistle, you blow a dog whistle, the dog can hear it, you can't. It's a similar kind of thing.
The research may help us to better understand what goes wrong in diseases associated with social withdrawal.
Diseases like schizophrenia, for example, or autism that I mentioned. When you have challenges with how you interact with another person, it really impacts your quality of daily life.
It's hoped that the research may one day lead to new treatments. Despite the challenges presented by the pandemic, it's back to school and work for the new academic year.
I want to take this opportunity to welcome everyone back to school and back to work. Even though this year, welcome back may have a somewhat of a different meaning. Even though we experienced one of the most challenging years in the School of Medicine's history, we can all be proud of the tremendous accomplishments that we have achieved. I want to extend my appreciation to each of you for your dedication and your pursuit of excellence during these difficult times. We have much work ahead of us, but thankfully we have all the right persons right here to make it happen. So to everyone, I extend my heartfelt greetings. Welcome back to work, welcome back to school. I wish you a happy, safe, and successful new academic school year.
In partnership with the School of Medicine, the University of Maryland Children's Hospital has opened a trauma-informed psychiatric care unit for kids and adolescents suffering from serious mental health problems.
One that most people think about first is suicide. I know that sounds surprising, but particularly with COVID, large numbers of children are reporting having some suicide ideation to the point where some of them are actually acting on it.
Many children endure adverse events that affect their mental health over time. These include abuse, neglect, violence, school issues, and other traumatic events.
Our new state-of-the-art unit will provide crisis stabilization and a place to recover in an environment that is sensitive to individuals who have been exposed to trauma in their lives. We will provide person-centered, evidence-based treatment that is connected to the entire family.
The first of its kind in the state, the 16-bed unit uses soothing colors, calming sounds, and painted murals to give kids a safe space to heal.
One of the real issues with children who are suffering from mental health is that we've taken away their control. And this unit was built in a way where we're trying to give back some of the control. It's very soothing. There are opportunities for these children to have some control in terms of the music that's piped into their rooms, in terms of how their day is structured.
And that's Frontline News. I'm Larry Roberts. I hope you'll join us again in 2 weeks.